Good morning, everyone. My name is Crystal, and I'm Dr. Curtis's nurse. Today, we're going to go over the things that you need to know for your pre-op and post-op care and your diet progression after surgery. So, in front of you, you should have a burgundy folder. On the left-hand side, you're going to have a stapled pack of information, and you're going to have one singular sheet that's sticking up behind it. Go ahead and pull those out. We're going to be going over that information. These are your packets. I always encourage patients to take notes, to write on them. That way, you have things written down that you can reference back to. On the right-hand side of this folder, you have a sheet in the front that has some numbers with some lines beside it. That is for you to write down any questions that you may have for Dr. Curtis. So the first thing we're going to go over, this informational packet that's stapled together. Dr. Curtis does not want you on social media groups. He does not want you on Facebook, Instagram, TikTok, any of that, getting medical advice from random internet strangers, okay? However, at the top of this page are websites that Dr. Curtis actually does approve of. There's some really great recipe blogs, there's some great weight loss surgery lifestyle blogs, and there's some really good mental health blogs up here as well. If you are someone who likes physical media, you want something to hold in your hand, something to highlight, something to write on. At the bottom of this page are books that he actually approves of. And the very bottom book is a really, really good cookbook that has a lot of creative ways on how to get your protein in. Pre-op diet wise, so you should have already been aware that you needed to do a protein shake at breakfast, protein shake for lunch, and a meat and vegetable for dinner, a non-starch vegetable. And generally, his rule of thumb is about 5 ounces of meat and a half a cup to a cup of the vegetables. This helps shrink the liver and it helps give him easier access to your organs and to your stomach in order to do the surgery. Now, day before surgery, you can have your protein shake for breakfast, but you can have a normal lunch. But please, please, please don't go do what we call Last Supper syndrome. Don't go, oh my God, I'm never going to have a Whopper again and go get that. Oh my God, I'm never going to have a Big Mac again and also go get that. And then go, oh, I need some Cracker Barrel in my life and go get that. That'll make you miserable. I always tell everybody get something you're going to be jonesing for the first 6 weeks after surgery and make that your lunch. Me, I had gastric bypass with Dr. Williams, our other surgeon, in May of 2024. And my last meal was barbecue. I needed some barbecue in my life, okay? And so get something that you know that you're going to want this for 6 weeks. Now, the night before surgery, starting at 6 p.m., is when your liquids start. And these are the things that we consider liquids: cottage cheese, mashed potatoes, blended soup, and blended soup is exactly what it sounds like. You have a soup, you chunk it in the blender. And with these blended soups, you don't want any meat in there because you're not going to be able to tolerate any of the grease strandings. So you could do an egg drop soup, you could do a vegetable soup with no meat in it and throw it in the blender. You could do a noodle soup without any meat in it, throw it in the blender. You can have low sodium broth. You can have yogurt. When we talk about yogurt, I like to call it no surprise yogurt. So you don't want to put a spoon in there and have to mix anything into it. We want no surprises. We want just yogurt in that cup. So no seeds, no chia seeds, no oats, no granola, no M&Ms, no fruit, no Oreo pieces, none of that. No surprises. The safest yogurt that you can get is the Oikos 000, and it's in a little bitty black pot. You can have any flavor of that you want. You can do sugar-free Jello, that's the jiggly kind. You can do sugar-free pudding. You can do oatmeal. You can do grits. You can do cream of wheat. You can do applesauce. Now, with this food, it's going to need to be a lot thinner than what you're probably used to. You're going to know that you have the right consistency by picking up your spoon, tilting the spoon. If whatever's on there slides right on off, you've got the right consistency. So when we talk about things like mashed potatoes, you're going to need to make them a little thinner than what you're probably used to. The absolute most important thing that you need to do the 3 days prior to surgery is get a minimum of 80 ounces of water in a day. You need to aim for 100 ounces of water a day. And in addition to that, we want you to have about 8 ounces of a Gatorade Zero or a Powerade Zero or Pedialyte each day as well. Now, you can use sugar-free flavoring packets for the water. So you could use Crystal Light, you can use any sugar-free pack that you want. If you get sugar-free Liquid IV or the sugar-free Propel or the sugar-free Gatorade pack to add to the water, that would count for your 8 ounces of Gatorade Zero or Powerade Zero or the Pedialyte. But please, please, please get that water in. Let's say your surgery's on a Thursday. That Monday, Tuesday, and Wednesday, you need to be getting that much water in, 80 ounces minimum. Aim for 100. The juicier that you are going into surgery, the better you bounce back afterwards. So you tend to not have as much nausea and vomiting. You tend to not have as much gas pain. You just overall do better. It sets you up for success. At midnight, night before surgery, nothing to eat or drink after. Dr. Curtis is going to go over with you today what medications he does want you to take and what medications he does not want you to take prior to surgery. If you are currently on Mounjaro, Zepbound, Ozempic, Wegovy, Trulicity, Saxenda, you need to stop that a week before surgery. So let's say that you normally inject on a Friday and your surgery is on a Wednesday. The Friday before surgery, you are not going to take that medication. Dr. Curtis will actually let you know when to resume taking it after surgery. On this page, we've had surgery, and these are the things that we can expect immediately after, or the guidelines that we have for you immediately after. First things first, no lifting anything over 25 pounds for the first 3 weeks. Nothing over 10 pounds for the first week. And I promise you, just from personal experience, you really aren't going to want to be bothered with lifting anything that first week. When the nurses wake you up after surgery, they're going to have you breathing into an incentive spirometer fairly quickly. On the table in front of you, there's a device that has a blue tube. That's an incentive spirometer. It is graduated, so it has some numbers on the side of it. When they wake you up and get you breathing into that incentive spirometer, the nurses will tell you which number to aim for on that. When we put you to sleep for surgery, we are operating your lungs, and we can't have full expansion of your lungs because that would move your abdomen, and we don't need your abdomen moving while Dr. Curtis is trying to do your surgery. So we barely have your lungs moving, and this incentive spirometer will help to strengthen them back up after surgery. We want you taking your pulse and your temperature twice a day for the first 7 days once you go home from the hospital or the surgery center. If your pulse is consistently staying over 120 and you're running a fever of over 101 that Tylenol is not breaking, give us a call. Depending on where Dr. Curtis is, he may want you to meet him at the hospital, or if he's here at the office, he may tell you to come in. Generally, this just means that you're dehydrated and we need to give you some fluids. Once you go home from surgery, if you have any persistent nausea or vomiting that lasts more than 8 hours, or any persistent abdominal pain that lasts more than 4, give us a call. We are going to be sending in medications for you for after surgery for nausea and vomiting and for pain. This means you've taken those medicines and they're not helping. And since I've been doing this for Dr. Curtis, I haven't had anybody have to call me on those. Please, 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 no getting pregnant for 18 months after surgery. Please use caution. Every 5 pounds that we lose increases our fertility rate by 10%. You are still going to be losing weight, and your body is still going to be healing for the first 18 months after surgery. It takes that first 18 months to heal all the way down to the cellular level. So please, please, please use caution. When you go and pick up medications that Dr. Curtis is going to be sending over for you today for surgery, please go ahead and pick you up some chewable Gas-X, and you can get the generic version that's called simethicone, but please pick that up. The worst pain after surgery is the gas pain. So you can expect to have 4 to 6 small little 1-inch incisions across your abdomen. And what we do with those incisions is we use rods to get equipment in for Dr. Curtis to do the surgery and to slim your stomach down. but we also inflate you with a gas so that he can see all of your organs. We are not going to deflate you as soon as he's finished with surgery. When he's finished doing what he needs to do on the inside, he's going to sew you up. So on the inside, he uses a dissolvable stitch, and on the outside, he uses a Dermabond adhesive glue. On with that glue, day 7 to 10 after surgery, if you still have some excess glue on your skin, you can use 100% acetone fingernail polish remover to get that excess off. You don't have to worry about opening yourself back up. It's not going to all of a sudden make the incision open. It's just going to take the excess off of your skin. The worst pain is the gas pain. It feels like someone's taking their fist and kind of shoving it into the base of your abdomen. And it can also feel like you have a fist that's shoving up in your esophagus. So there's 4 things that you can do for that to help. Number 1, water, fluids, hydration. Get your fluids in. That'll help the body reabsorb this gas. 2, getting up and walking. Dr. Curtis wants you up and walking 15 minutes every hour while you're awake. And the nurses are going to have you up and walking really quickly after surgery. We are not asking you to walk 3 miles in 15 minutes. What we're asking you to do is be up and moving around for those 15 minutes. And you're free to go up and down stairs. You can walk up and down hallways. If you're staying at a hotel, you can walk around the hotel. You can go Kroger, Walmart, Target, walk around. You know your body better than anybody. So as far as the distance, you'll know, hey, that's about as far as I can go. Like I said, we're not asking for 3 miles in 15 minutes. We're just wanting you up and moving for the 15 minutes. Third thing is the chewable gas eggs. You normally on the back of the box, it says no more than 3 to 4 in a 24-hour period. Dr. Curtis will tell you don't pay attention to that. You can chew that gas X like candy. Take it as much as you want. What worked the best for me after surgery was I would chew a simethicone. I would wait 5 minutes. I would chew a second one. And then I would get up and do my 15-minute walk. And when I sat down, I would chew a third one. And that really helped. The 4th thing you can do, when that gas breaks up into smaller bubbles, it can travel and it can move and it can get stuck up in the shoulder. Now, if that happens, it can feel like a heart attack. You can feel like an elephant standing on your chest. You can feel like it's hard to take a deep breath. Whoever is helping you recover, whatever family member is helping you recover, sit up really nice, straight and tall for them, and then have them pat on your back like they were going to birth a baby. And that will help get that gas moved out of your shoulder. Overall, it takes about 2 to 3 days for that gas to completely get out of your system. No donating any blood, no selling any plasma for the first 18 months after surgery. Your plasma is what's in your blood and helps you heal. And you need every bit of it. No drinking through a straw after surgery. What happens if we drink through a straw after surgery is that it can introduce air to our couch. It's going to cause a lot of pressure, a lot of pain, and it'll cause you to throw up. So no straw drinking after surgery. No submerging yourself into a body of water for the first 3 weeks. So no tub bathing, no hot tubs, no swimming pools, no ocean, river, lake, creek, pond, none of that for the first 3 weeks. But please do take a shower. And you are fine to use a washcloth or a loofah to go over your abdomen. You're not going to mess anything up, okay? This page is our lifestyle change. This is going to be your progressive diet after surgery. Stage 1 starts from the time that you wake up and it lasts for 2 weeks. This is your liquid stage. So you can have anything from 6 p.m. the night before. You can have cottage cheese, sugar-free Jell-O, low-sodium broth, cream of wheat, applesauce, blended soups, the No Surprise yogurt. You can have sugar-free popsicles, and I highly, highly encourage you to pick up some sugar-free popsicles. When we put you to sleep for surgery, we have that plastic tubing in your throat. That way we can keep your airway open so we can breathe for you. We don't put it in until you're asleep. We take it out before you wake up. But because it's a foreign body that goes in your throat, it can cause your throat to be really scratchy, really itchy, and just kind of sore after surgery. Those popsicles really, really help to soothe that. So I highly, highly recommend picking up some sugar-free popsicles. And you can have any flavor that you want. But please just remember, if you happen to get a red one or a purple one and you do wind up throwing up, please remember you had a popsicle. It is not blood. Because this stage is full liquids, you're going to need 60 grams of protein from your protein shakes a day. So no matter what stage you're in, you're going to need 60 grams of protein a day. You're going to need 64 ounces of water a day. Your meals should take you 30 to 45 minutes to eat. Nothing to drink with your meals. Nothing to drink until 30 minutes after your last bite of your meal. At the very beginning, I would set a timer for myself. Now I just kind of eyeball it. I, look at when I took my last bite and I'm like, oh, 1:15, so I know I can have something to drink around 1:45. But when you drink with meals, one of two things happen. First thing that happens is it can expand the pouch. So now if your pouch is bigger, you're hungrier, more food, more calories, weight gain. The second thing that it can do is it'll go ahead and start sending some food down to be digested. So now you're not as full as long. So now you're hungrier, more food, more calories, weight gain. So please, please, please make it your priority to break any habit of drinking with your meals. What I generally tell family members that are helping you recover is when you have some type of food in front of you, whether it's a soup or yogurt or whatever you're determining in the beginning is your meal, go ahead and remove any liquids or anything to drink away from you. That way you do not do the muscle memory of reaching for that drink and taking that sip. Now, because it's liquids, you're going to need 60 grams of protein from protein shakes. There are protein shakes that you want and protein shakes that you don't. You should have an Ensure Max protein in front of you. If you'll look at that package with me, I'm going to give you the easy cheat method on how to know if a protein shake is for you or if it's not. On packaging, these companies have gotten really great at listing the amount of sugar and the amount of protein. If you can easily determine 1 gram or less of sugar and 30 grams of protein, I want you to flip that package over to the calorie indicator, okay? If you can determine 1 gram of sugar or less, 30 grams of protein, look at the nutritional label. If it has 150 to 200 calories, yes, that protein shake is for you. If you flip it over and it says anything like 300 to 500 calories, no. Put that thing back on the shelf. That protein shake is not for you. So the ones that are safe are things like the Ensure Max protein. You could do Premier protein without the oats. You can do, there's one called Ungery. And then my personal favorite are the Fairlife Nutrition Shakes. I get these from Sam's Club, but you can also order them off of Amazon. And I do believe they're also in Costco and BJ's Wholesale as well. These are, they don't have any aftertaste. They're not chalky. If you shake it up really well and put it on its side in the freezer for about 3 hours, it'll taste like a Wendy's Frosty. The Ensure Max protein, they're really good. You can also do like a smoothie in the beginning stages with these. You could just take ice and blend it up with it. You could add milk if you wanted to. Nothing with seeds, so don't add any strawberries, but you could do a banana or things like that with a smoothie with the protein shakes as well. And that can help soothe the throat too. Now, in the very beginning, it's really hard to get your water and your protein shakes in. So you're going to get some medicine cups from the nurses, put water in one, put protein shake in the other, take a small sip of water, wait a minute or so, take a sip of the protein shake, wait a minute or so, take a sip of the water, and you're basically just going to rinse and repeat all day long. And that's how you're going to get your fluids in at the very beginning stages. I always tell everybody, do not feel like a failure if you can't reach those goals straight out the gate. You're learning your new body. You're learning how to process the information that it's telling you. You know your body better than anybody. So what I always tell everybody, let's say day after surgery, you get 12 ounces of water in and maybe 8 ounces of a protein shake. The next day, you need to aim to get more in. So if you got 12 ounces of water in the day prior, aim for 24 ounces of water. You got 8 ounces of the protein shake in, aim for 16 ounces of the protein shake and just every day build up to get more and more in until you reach those 60 grams protein, 64 ounces of water. Now, there are a couple of things on the table that you can look at that are also a great idea on how to maximize what you can get in. So there's things like protein water, and there's a big pink bottle on the table in front of you. That is Celebrate. Celebrate protein water will count towards your protein goals and your water goals. So that bottle is 12 ounces of fluid and 20 grams of protein. You can also do, there's one called Bariatric Advantage Protein Water. It's 16 ounces of fluid and 20 grams of protein. And then there's a really small white bottle on the table. Those are protein shots. Those help patients out a lot in the beginning. That is 3 ounces of fluid and 15 grams of protein. That's really a great way to get your protein in small amounts to kind of help you build up what you're getting in. So you can also use that as a tool to help you. Now, stage 2 starts 2 weeks after surgery. It's going to last for an entire month. This can be anything from stage 1, but now we're going to get to add fish. So you can have things like tuna, salmon, cod. You can also have cooked seafood. So you can have oysters, shrimp, crab, lobster, scallops, any of that. Nothing fried, nothing deep fried, nothing air fried. You can do baked, broiled, roasted, or grilled. You can also have soft fruit like grapes or bananas. You can have well-cooked vegetables, and I do get a lot of questions on what that is. Pretend like you have a 9 or 10-month-old that you're trying to feed string beans to for the first time, and you don't want them getting choked up. So you're basically going to boil them to death. You can have eggs. You can have soft pasta. Now, this does say you can have toast and crackers, but you need to wait until the latter part of this stage before you try those toast and crackers. Give your stomach the best opportunity to heal before you try something like that. The first thing that we always recommend trying in stage 2 is scrambled eggs. And you want them just a little bit glistening. Please do not cook these things to where they're crunchy. So you want them to have just a little bit of a sheen on them, just slightly glistening. Try that. Most patients can move up to stage 2 at the 2-week mark. Occasionally, we may have a couple of patients that can't tolerate the eggs, and you'll have to stay on liquids for maybe another 2 or 3 days and then retry the eggs. And generally, at that point, you're able to move up. So because we are adding foods that have protein in them in this stage, you should only be getting 30 grams of protein from your protein shakes. Now, your goals are still 60 grams of protein, 64 ounces of water a day. Meals should take 30 to 45 minutes, and nothing to drink until 30 minutes after your last bite. Okay. Stage 3 is your permanent lifestyle change. This starts 6 weeks after surgery. And this, I basically call the whole food stage. You can hit the road running at this point. You can have any type of animal protein that you want. You can do lean beef, so 80-20, 90-10, 93-7. You can do chicken, you can do turkey, you can do veal, you can do venison, you can do bison, you can do fish, you can do tofu if you wanted to go that route. You can also have fruits and vegetables. Your protein shakes should be discontinued at this stage because you should be getting your 60 grams of protein completely from your food. However, we always tell everybody to keep a protein shake on them because you never know where you're going to be, where you're not going to be able to get something to eat. And we would rather you have the protein shake than skip a meal. And then I do like to make mention of this sentence, this in the stage 3 paragraph, okay? Consumption of bread and pizza is strongly discouraged. Now, we're not saying you can never have bread or pizza again, but I want you to remember why you're doing this surgery, why you want this better lifestyle, and start thinking about food in this manner. Is this the best option to fuel my body with? And when you start thinking about food like that, food doesn't have as much control over you as it previously did. So this is not saying you can't have bread and pizza again, but it's not the best option to fuel your body with. I get a lot of emails and a lot of questions of, I'm tired of chicken and turkey. What else can I do for my protein? On this page, it lists all types of foods that are high in protein. It gives you the measurement, and then it tells you how many grams of protein are in it. So if you email me or you ask me about food, I'm always going to tell you to go back to this page. The best thing that I had in stage 2 was refried beans. Those are really high in protein, and it was the best food, the best thing I had had at that point. So I do highly encourage using, refried beans and things like that as well. Flip the page. All right. At the top of this page, this tells you which protein shakes to choose and how to choose them. We went over that. And then the second part says which ones not to choose. So you don't want the regular Carnation Instant Breakfast. You don't want the Boost Shakes. You don't want the regular Ensure. You don't want the Fairlife Core Elite. You don't want the Fairlife Core Pro. You don't want any of the Boost Shakes. Those shakes are made to put weight onto people, and we're trying to do the opposite. So like I said, the easiest method for you to look at your protein shakes is going to be 1 gram of sugar or less, 30 grams of protein, and then look at your calorie indicator. Okay, 150, 200 calories, you're great. This third section here just gives you some tips and tricks on how to make your meals last 30 minutes. The biggest tip that I can give you is to get a baby spoon and a baby fork and use that for your meals. That will help you not take too big of a bite. It'll help you slow down, and it'll also give you time to process what you're putting in your body and get feedback from your body. Now, the second thing that can help is when you pick your spoon, fork up, whatever utensil you're using to eat, pick it up, put that bite in your mouth, and then take that utensil and put it all the way down and let go of it. When you start doing that, that helps slow you down. It gives you time for your body to send you signals about how you're processing this food. And then you'll start noticing other people around you and how they eat. And you'll start to notice generally people never put their utensil down. They just continue, take a bite, go right back in, grab another bite, take another bite. So take one bite, wait 5 minutes, put your utensil down, and those type of things can help you slow down and make your meals last 30 to 45 minutes. I always tell everybody, you're going to have what I lovingly refer to as no-no foods. No-no foods are foods that when you take a bite of it, your mouth immediately tells you, no, do not swallow this, do not pass go, do not collect $200, spit this out. Please listen to your body. If you swallow that anyway, you are going to be miserable. You're probably going to throw up. Then we also have foods that I like to call foods. Those are, you take a bite, mouth's okay with it, you swallow, it gets to your pouch, and your stomach's like, oh yeah, we're okay with this. If it's the first time you're trying a food, I don't care if you're a day out from surgery, a week out, a month out, a year, 10 years out from surgery, if it's the first time you're trying a food, take one bite, wait 5 minutes before you take another bite, because what can happen is everything's okay in the mouth, it gets to the stomach's initially okay, but you wait those 5 minutes. Sometimes minute 3, your stomach's like, oh yeah, remember me? We're not good with this. And it'll send it back up. Take that bite, wait 5 minutes before you take another. At the bottom of this page are just some examples of high protein foods. On this page, we just have some goals that we would like you to meet. And I'm not going to read all of them to you. You're going to get the gist very quickly. The first goal we like you to meet is no vomiting. Of course, we don't want you vomiting. No one wants to vomit. So the things that you can do to help with that is eat slowly, take small sips of your fluids, no straw use, and no carbonated drinks. Second goal we have for you, get enough fluids. We want you getting enough fluids because we don't want you getting dehydrated. You get dehydrated after surgery, you're going to feel like a slug. You're not going to want to get up and move around, and it's just going to lead to other complications. So please, please, please get your fluids in. I always recommend patients to go ahead and pick up a stool softener and start taking that twice a day, and then get you some Miralax. Miralax only needs 4 ounces of water to mix into, and ideally you want to start taking that after surgery for about the first 5 to 7 days. That way you make sure that you're not going to get constipated. So what you can do is, what I did was took 4 ounces of fluid in first thing in the morning, mixed my Miralax in it, and made that my goal to get that down as quickly as I possibly could. You're probably not going to have a bowel movement until about day 3 or 4 after surgery, and we do not want you getting constipated. So please, please, please get your fluids in, get a stool softener, go ahead and just make that part of your routine to take twice a day, and then get you some Miralax, okay? Flip the page. You are going to need a bariatric multivitamin for the rest of your life, and you're also going to need 1,500 milligrams of calcium a day. Now, the reason a regular over-the-counter multivitamin won't work is because we're taking your stomach and we're making it so small that if whatever you absorb from an over-the-counter multivitamin is not going to be enough for you, you're not going to get enough out of that. These bariatric multivitamins are formulated so that as you absorb it, you get everything that you need. They make the multivitamin in a soft chew like a Starburst. They make them in a hard chew like a Flintstones multivitamin. They do make a capsule, but that capsule is really, really big, and you're probably not going to be able to tolerate it till about month 3, maybe month 6 after surgery. And then your calcium, you can have 1,500 milligrams of calcium a day. Calcium is for your bone health, heart health, thyroid health, metabolism. You need the calcium. If you do not take your calcium, we can see it on your lab work. So not taking your calcium, your body's not going to go, oh, we're out of calcium and we're going to make you sick. It's not going to do that. What will happen is it'll start stealing it from your bones. If you continue to not take your calcium, your teeth will fall out. So please, please, please make good choices, good habits. Take your multivitamin, take your calcium every day. If you are someone who is currently, has a handful of pills and you're used to going and tossing them back, you're no longer going to be able to do that after surgery. One pill, wait 5 minutes. Next pill, wait 5 minutes. Next pill. There's 2 exceptions. First exception, Dr. Curtis is going to send over omeprazole for you for after surgery. It's an acid reducer. It's going to keep the acid levels low in your stomach so that your staple line heals well. He wants you to take that the first 90 days, no matter what. And you would take that first, wait 30 minutes, and then you'll take a pill, wait 5 minutes, take a pill, wait 5 minutes. The second exception is if you take something for your thyroid, you're actually going to take that first, wait 30 minutes. You'll take your omeprazole second, wait 30 minutes, and then you'll take a pill, wait 5 minutes, take a pill, wait 5 minutes. Some patients complain, this is going to take me all day to take my meds. Remember, you're doing this for a reason, and any medications that we can get you off of after surgery, we're going to try to get you off of those. So there is light at the end of the tunnel. Hopefully, most of the medications that you're on will just be, temporary, and we can get you off of those. No NSAIDs after surgery. So you're not going to be able to have any more ibuprofen, goody powders, Aleve, naproxen, Excedrin, anything like that, because we're making your stomach such a smaller size. Those type of medications cause stomach ulcers. And because your stomach is so much smaller now, those ulcers can eat a hole right through the wall of your stomach. So no more NSAIDs and no steroids. However, sometimes patients call me because they've gotten a sinus infection, they might have gotten an upper respiratory infection, and their doctor wants to put them on a steroid dose pack that just lasts 5 or 6 days. That's fine because you're not permanently going on any steroids. That's just a short time thing. You're okay to take that. On this last page, this just gives you an idea of what to expect as far as your follow-up visits with Dr. Curtis. So we'll see you 1 week after surgery, a month after surgery, 2 months after surgery, 3 months after surgery, 6 months after surgery with labs, and I email you a lab slip about 3 weeks ahead of time. You are free to take that wherever you want to go. You can go to LabCorp, you could go to Quest, you can go to your primary care physician if you wanted to. He's going to see you 9 months after surgery, a year after surgery with labs, 18 months after surgery, and then every year after surgery. So if your surgery date's November, then we're going to see you every November after that. At the bottom of this page are support groups that he actually approves of. They're run by the hospital. You can log on virtually. You could be anywhere in the world and log on, and they don't even make you turn your camera on. So that's a great resource for you as well. You have one singular sheet in front of you that we pulled out earlier. It's called Medications for Surgery. This is the last thing that we're going to go over before you go see Dr. Curtis. This right here, I like to remind everybody, we have two physicians here and they do things differently. This list is all encompassing for both physicians. You're not going to get everything on this list, okay? So, taking a look at this list, the gabapentin, he is going to prescribe that. It's only going to be 2 pills. He wants you to take one the night before surgery and the second one morning of surgery. This is for any nerve pain. So this kind of helps the stomach chill out and not send you as much like pain signals after surgery. The scopolamine patch, it will be 2 of them. You're going to put one behind your ear the night before surgery, and it stays on for 3 days. So if you've been on a cruise or if you've been on a plane and you've seen people with the tan patch behind their ear, that's what this is. It helps with motion sickness, but it also helps with nausea and vomiting. And anything that we can give you to help prevent any nausea or vomiting, we're going to give you. So night before surgery, you're going to put this behind your ear. When you put it on, please go ahead and wash your hands, because if you touch this patch and touch your eyeball, you're going to have a bad time. It'll dilate your pupil and it'll actually make you sick. So just put that on, wash your hands. The day after surgery, you're going to take it off and you're going to put the second one on the other side, and it'll last for 3 days. Okay. Zofran is also called ondansetron. This will be a pill that dissolves under your tongue for after surgery if you need it for any nausea or vomiting. The Percocet or Ketorolac, he's not going to give you both of those. He's only going to give you one. We're not going to give you anything that you would be allergic to. These are for pain control after surgery. Please, please, please remember, Percocet is an opioid and it can constipate you. If you have to take the Percocet, please make sure you're getting your water in. The omeprazole, that is for the stomach acid to lay low, to help that stomach staple line heal. He's going to want you to take this the first 90 days, no matter what. The Levsin is also called hyoscamine. This is another pill that can dissolve up under your tongue. It's for any stomach spasming if you have it after surgery. Some patients don't have any stomach spasming issues. I always tell patients stomach spasming feels a little weird. Sometimes it feels like a hand has reached in and grabbed your stomach and just kind of starts shaking it. And for female patients, the best way I can probably describe it is that it can almost feel like a menstrual cramp, but way, way high up, like right below your rib cage. So if you notice that your stomach feels like that, just use this Levsin, put one under your tongue, let it dissolve. The Emend is called a Prepitant. This is the singular most important medicine. This is liquid gold in a capsule. This is the best thing that we can give you for nausea and vomiting directly related to anesthesia. Dr. Curtis sends in 3 of these. So what he ideally likes you to do is take one the night before surgery, one morning of surgery, and one the day after surgery. But a lot of insurance companies won't pay for 3. If you get to the pharmacy and the pharmacy says, hey, your insurance isn't going to cover all 3, tell them, give me one, just give me one of them, and take that the night before surgery. When you get to the hospital or to the surgery center with Dr. Curtis, let him know, hey, my insurance wouldn't cover all 3. It would only cover 1, and he will make sure you get the other 2 at the hospital or the surgery center, okay? Acetaminophen is Tylenol, and I always recommend everybody to pick up some liquid Tylenol for after surgery. And the reason I say liquid is because you're not going to want to deal with another pill. So pick you up some liquid Tylenol. This can help with the pain as well. And then the last one that's listed, the celecoxib, is Celebrex. He does not prescribe that, so you don't have to worry about that one. That is everything that we're covering today. So you can put all of your information back in your folder, and you can put all of that stuff into those bags that's in front of you. And now you'll be going back to see Dr. Curtis. You're going to sign your consents for surgery with him. He's going to go over your prescription medicines or the medicines that you currently take and tell you what to stop or what to take for surgery. And then any questions that you have for him, please make sure you ask. Okay. I am so excited for you on this journey. Welcome to the first day of the rest of your life. If you have any questions or anything and you need to email me, certainly reach out. I always tell patients I'll be honest with you about the journey and about, what to expect or how you're going to feel. So any questions that you have, you can certainly ask me. And we are so happy to have you here with us and Dr. Curtis. You guys have a wonderful day.